Doctor, I am 55 years old. I am quite bald. Can I do a hair transplantation? Doctor, I am 65 years. I have a mild blood pressure. Otherwise, I am healthy. Can I do blood pressure? Will I get result? To answer these questions, I am Dr. Venkatram Mysore, dermatologist, hair transplant surgeon, Venkat Center for Skin, ENT and Plastic Surgery, Vijayanagar, Banashankari, Bangalore. We do hair transplantation for elderly patients. Yes, we can. Is it safe? Yes, it is. Will they get result? Yes, they can get result. These are simple, straightforward answers. These are all subject to 2-3 issues which I will tell you now. What is the first issue? Is the person healthy? The patient should be fit for surgery, like any surgery. Just look at it. Elderly patients undergo heart surgery. Elderly patients undergo knee surgery. Why not hair transplantation? Yes. But we have to check their blood pressure, sugar, assessment of the heart, ECG, echo, take a detailed drug history. Are there any other drugs, blood thinners like aspirin, platelet drugs? Then make an assessment. If there is any issue, we refer them to a physician. The physician has to clear whether he is fit for surgery or not. And then only we can accept. And then while doing the surgery, we take an additional precaution. We have an anesthetist present throughout the surgery. So this is regarding the fitness. The second part, what is the stage of baldness? Usually when they come late, they are in stage 5, 6 or 7, very large areas of baldness, needing 6,000, 7,800, 8,000 grafts. So to get that many grafts, does he have a good donor area? Again, with passing of age, the donor area becomes small, donor area becomes thin. So they may not have a very good donor. In that case, do they have a good beard hair? Do they have good chest hair? And more importantly, are they willing to take it from the beard or from the chest? Depending on this, after a careful assessment of the donor area, we can say you can get 4,000 grafts, 3,000 grafts, 5,000 grafts, whatever. And then we have to explain how much area it can cover. That is a very important step. What is the patient's attitude? Is the patient willing to accept how much area can be covered? When somebody comes at this stage, the most important thing is realistic expectation. We have to clearly explain what is possible, what is the maximum possible. They have to assess and accept that this is what is possible and I am going to accept it and be happy with it. If that can be done, the patients can be extremely happy. Like for example, this patient. You can see this photo. In this, we have not covered the vertex area, but he is very happy. Again, in some cases, if they accept body hair, they also become very happy. You can look at this photograph. This result is after scalp and body hair. So this is possible, techniques are available and surgery can be done, there is no problem. Usually drugs do not have a major role at this stage because most of the hairs will have been lost. Now people are getting affluent, awareness is more, they will have finished their responsibility at 55, 60. They want to enjoy life, they want to take cruise, they want to travel. Likewise, they also want to look good. There is nothing wrong with that. So they want to do transplantation. So the answer is yes, surgery is possible with a proper assessment of the health status of the individual, proper assessment of the donor area, and then proper thorough counseling of what can be expected, what is the maximum that is possible. If these people accept it, then the surgery definitely can give a very pleasurable result to these patients, as you saw in the photos that I showed you. The maximum age I have operated is 73 years. I still remember there was one patient of 67 years. He did FUT and FUE. 2 days later, he flew to San Francisco from Bangalore. There was another gentleman, 62 years, who did the surgery FUE. The next day he had a boardroom. He was the managing director of a very large company. He put on a cap and went to the boardroom. I asked him, will people ask you? They said they dare not ask because I am the managing director. So attitude is what is important, and with modern medicine these things are definitely possible. We have good experience of these things. Some people say, I don't want from the body, I don't want from the beard. In that case, the limitation is something that they have to accept. What can be done? Platelet rich plasma can be tried, and the combination technique FUT and FUE can also be tried because these people's skin is fairly lax. One thing we have to explain here, and that is, after the surgery these people may develop some swelling of the eyelid. Any hair transplant can cause that problem, but these patients are more likely to get the swelling around the eyes because their skin is lax. The other issue is, as I explained to you, when they are coming alone from another city, it is preferable to stay in a hospital for night because we need to prevent any problems that can happen. To summarize now, yes, transplantation can be done in elderly individuals. It can be done for men, it can be done for women also. Three factors have to be assessed. One, what is the status of their health? Are they healthy? Depending on that, they will need a proper investigation, assessment and physician clearance. Two, assessment of the bald area and assessment of the donor area, and then determining what is the maximum area that can be covered, counseling the patient probably. Three, patient's attitude, whether he is willing to accept what is maximum that can be done, whether he will be happy with it, whether he wants beard and body hair transplantation also, whether he is willing to go through that. These three factors are all that is necessary. Once it is done, transplantation can be done. I hope you have liked this video. If you have liked it, you share it. Please give your feedback. Visit venkatcenter.com, and we hope to come to you with more and more videos like this. Thank you very much.